Good morning, everyone. Once again, Dr. Salim is here with you guys. Quick question. Maybe somebody may ask you this question, or maybe it just coming to your mind that when I can have a better image quality, or when I can have a really detailed picture, or when I can have a really good resolution picture, the picture which is highest quality picture. Easy and simple. Try your best to use a high frequency transducer. That's one. There are two conditions. There are two steps. If you apply these two steps, you will have the best image quality or more detailed picture or more diagnostic picture in your sonographic field. So one, pick the highest frequency, operating frequency, the very high operating frequency transducer. That's one thing. And secondly, try your best to place the focal point or focus at the area of interest, where is the target tissue, the tissue of your interest, the area where is more you want to be study that area. So put your focal point or focus on that area. Now maybe somebody gonna think about that, how that will make my picture better. So there are two resolutions we're talking about. One resolution is axial resolution, which distinguish the smallest distance between the two structures, which are front and back to those structures. When the sound is coming from above and they're penetrating down, so the two structures which are front and back to each other, or we can say they are parallel, their distance is parallel to the sound beam, main axis beam. So that will distinguish, that will find out where if there is a distance between these two structures or no. So if there is a distance, the smallest distance will be catched by the high frequency transducer. Now another question comes in this, that how this is possible that the high frequency transducer can figure out that smallest distance between the two structures, and low frequency transducer or probes cannot find out that or cannot detect that. Then the answer is easy, because we all know that axial resolution is determined by the SPL or special pulse length. That is the length or the one length or distance of a complete pulse. Maybe the pulse is made of 2 cycles or 3 cycles, but from the beginning of the pulse to the end of that pulse, that distance is called SPL or special pulse length, and that is actually axial resolution is determined by that SPL. So the shorter the SPL, the better to catch or detect the smallest distance between the two structures when the structures are front and back to each other. So that will catch that smallest area. So for this reason, high frequency transducers have very short, a small SPL. So try your best to use the high frequency transducers, the high operating frequency transducer. So this will adjust, that will give you a better axial resolution. So that's one thing. So one resolution is already good. You are really good at that. Axial resolution is perfectly, you select a good resolution. Now the second step we said the focal point. Put the focus or focal point at the area of interest where you're doing your study on that area. So on that case, this will what lateral resolution determined by. So that's another question. So lateral resolution is determined by the beam diameter. How much is the beam? The narrower the beam diameter, the better the lateral resolution. So if you want to have a good lateral resolution in a picture, so you have to make your beam diameter smaller, narrow, like make it more smaller or thinner, not to be wider on that case. So how to fix that? You have to put the focal point at the area of interest. Or maybe somebody may say that I want to look for a long area, like a big distance. I want to look for that. For example, you're looking for liver, for example, and you want to look for the right lobe of the liver or left lobe of the liver. So you're looking for a long distance, a big distance, a more area. So in that case, of course, if you have one focal point, that will be the beam will be focused, or the beam diameter will be narrow in one point actually. So how about the rest of the liver? So in this case, what you can do, choose multiple focal point. So your machines most probably look on the Navology, you can find it for sure, it is there, and it's called focal zones or focal points. So either it's a button, it's a toggle switch, maybe it's a touch screen. Make it multiple, make more focal point on that case. The only not a side effect, but the only disadvantage of having more multiple point is your frame rate will drop. But anyway, if it's just one picture you need for the diagnosis, in that case, then it's fine if your frame rate is dropping because of choosing multiple focal points. But at least you will have a really better image quality. You will have a really better lateral resolution. So in this case, if we apply these two steps, that one was axial resolution, to choose the best axial resolution. So the best axial resolution is where? When you choose a high frequency transducer, when you choose a transducer which is producing short pulses, small pulses, because small pulses or short, they are very squeezed, so their SPL is shorter. So shorter SPL, better axial resolution, and that will be found in the high frequency transducers. And also, if you're looking into the lateral resolution, how to fix that, like I said, put your focal point exactly where you're looking to, like that area of target, area of interest, where your concern is, to put your diagnosis on it. So this way, you will be able to have the best image quality on that field or in that area where you're scanning, or where you're looking to something to diagnose it. So I think this will help you a lot. Try your best, and then look at your pictures. So please do not increase your depth too much. It's just for the frame rate. Just 1 centimeter, like I think I mentioned that before too. 1 centimeter extra is enough, but not like if you're looking something in a 3 centimeter and your depth is 7 centimeter. I think that is not acceptable, because it will just make your machine slower. You will have less frame rates, you will have less pictures per second. So in this case, try your best to have a better image, detailed picture. The picture will talk. So these two steps, if you apply them, I'm 100% sure it will help you. And please, if these hints, tips help you guys, share it with others also, who works in this radiology department, especially if they do their diagnosis on the sound or sonography, or it's all concept of sonography. So again, please, if you did not subscribe our channel, I think if you need more of these type of information to get the notification, subscribe the channel and try to share it with those who are in this field. Thanks a lot, and see you next time. Take care. Bye bye.